Good afternoon. I thought I would just start by giving just a brief overview of what Marshfield Clinic is. We're a group of about 780 physicians scattered across 40,000 square miles of central and northern Wisconsin and into the service area of the UP of Michigan. We have 7 dental clinics associated with Marshfield Clinic serving the needed and underserved areas of Wisconsin. We have a health plan and HMO, research division, lab division. Next slide. This is just the vision and mission of Marshfield Clinic, and I put it up not to read through it, but really to take a view of the mission and vision as it relates to the EMR and how that helps us to fulfill our goals. So we'll kind of keep that in mind as we move through the presentation. Next slide. So Senator Whitehouse had mentioned value. We've talked for a lot of years about quality. How do we improve quality? The new player on the block is value, and realizing that just improving quality may not solve our problem, and in fact I think most of us recognize it won't solve our problem. We really need to focus on more than that. So we can improve value by improving quality. We can improve value by improving patient satisfaction, patient safety, or reducing cost. So we believe Marshfield Clinic is doing that, and the EMR is really an integral part of how we achieve that. Next slide. So similar statistics that Senator Whitehouse had referred to. We spend a tremendous amount of money in this country on care for chronic disease. This doesn't even take into account the amount of lost productivity that our citizens have as a result of that illness. Next slide. So Marshfield Clinic, in conjunction with CMS, through the PGP project, really started to move into how do we look at value in chronic disease management, and how do we move forward in improving value that we can deliver to patients. But not only to our patients, but to the clinic and payers as well. So looking at all stakeholders in that equation. And what we learned is the EMR is really a very important part of that. The project highlighted the importance of collecting data and turning that data into information and knowledge. And to date, we've been awash in data, but nobody really learned how to pick that data out of the record and start to analyze it and look for opportunities. And the project really led us down that path, and what we were able to demonstrate is it is possible to impact the numerator in a positive way while reducing cost and really promote the improved value that we can bring to patient care. Next slide. So our goal is really looking at that quality equation and impacting each one of those particular metrics in the way that we want it to move. And any time that the clinic is moving forward with an initiative, we go back to the value equation and think about how is this impacting that, and how can we leverage any particular initiative to best achieve that goal. Next slide. So what I really wanted to do is also give you a little flavor for what Marshfield Clinic's EMR looks like. And we have our own, Cattails MD, which we started developing back in the early 80s. And we've actually had an electronic medical record in place now for 25 years. So we have a lot of experience, and having homegrown this, it's been a painful process, but I think it's taught us a lot, and it's allowed us really the opportunity to focus on the needs of the patients of Wisconsin and learn about the needs of the patients and build that support into the medical record. So what you have in front of you is basically the platform that we all work out of when a patient comes into clinic and is at point of care. We call it our clinical dashboard. And what you'll see is in the upper left-hand corner a pane that lists all of their current problems. So the provider is right away keyed in on what are that patient's particular issues. Below that, you'll see something called pre-serve or prevention services. And similar to Doug's slide that he had up, this is our way of really alerting providers as to the needs of the patient that day at point of care. So it could be wellness measures such as mammogram, colonoscopies, Pap testing. It may be chronic disease management. And in this particular case, this individual has diabetes, and so outlined on there is all of the evidence-based recommendations and guidelines built right into the record in an actionable way, such that the provider or any member of the care team that would be appropriate can identify the need of the patient and act upon that in an appropriate and efficient manner. You have vitals on the bottom. We can trend those vitals. So We use our medical record as a tool with the patient. Often I'll sit right down in practice with the patient and we'll share my screen on my device and we'll talk about what your blood pressure trend has been like and how that may match up against your weight trend and your BMI. So we really start to try to tie these things together in a visual way for our patients. Back up at the top on the right-hand side, you'll see a list of allergies or special alerts that may be appropriate for that patient. Below that, a medication list, and built into our medications manager is the ability to identify interactions between medications or reasons why the patient should not be on a particular medication. It also is drillable into the past history of that patient's medication use. So you can go right back into the record and find out when is the last time they were placed on any specific medicine, how long were they on it, etc. And then on the very bottom, any upcoming appointments. So both you and the patient can be aware of what's coming in the future. Next slide. I mentioned we have 7 dental centers in the northern part of Wisconsin. And I think one of the things that has really come into the limelight in the last few years is just how important oral health is on chronic disease state management. So the clinic has really started to dedicate resource into looking at how we can promote oral health and how we can get those records to communicate with each other. And similar again to what Senator Whitehouse had said, there's multiple different arms of health care for the patient. Their dentist, their hospital, their clinic, their nursing home, whatever might be appropriate for that patient, and how do we get those to communicate? So as we've started to meet the needs of northern Wisconsin as it relates to dental care, we've really started to develop a medical record for dentistry, but that speaks back and forth with the medical record. So all of the information put in my clinic with regard to the patient's allergies, medications, or chronic health conditions can freely flow into their dental record and assist in taking care of that patient's needs from a global perspective. And that same scenario holds true with nursing home in our area. Many of our physicians practice in the nursing homes. They take their devices with them and they have their electronic medical records available to them in the nursing home, as well as in several of our hospital partners that we work with. Next slide. One of the, I think, really powerful tools in practice is the ability to generate a real-time care summary. And every patient that comes in that has a chronic health condition leaves the clinic with one of these in their hands. So they really have a paper copy, and 95% of what I told them and went over their head at the time of their visit and didn't stick is on a piece of paper that they can go home and think more about. So you'll see their vitals from today listed on here. You'll see the mirror image of their pre-serve panel telling them what services are coming up and when they're next due and what they're overdue on. Next slide. You'll see a list of their diagnoses, allergies, and medications. And in the medication section, that's broken down in as patient-friendly terms as possible to let them know what medicines have changed today or have been discontinued today, so they can go home and they can change their weekly pill box in an appropriate way. And it also is a comprehensive list of all of their medications, including over-the-counter medicines or herbal medicines that they might be taking at the time. You'll see a list on the bottom of any upcoming appointments, again, so as we lay out our care plan, they know exactly where they need to be and when, and who they need to contact if they're having difficulties. Next slide. And then also some directions to the portal, which is the way that the patient can access their medical record when, in the vast, vast majority of their life, when they're not with us in clinic. And if they misplace this summary or they need additional information, they can go to the portal and they can access that on their time. And in the most patient-friendly way, we can do that. Next slide. We recognize early on in the process, though, that all of this is well and good, but if we can't give the care team feedback, if we can't measure what we're trying to change, there's no way we're actually going to improve the quality. So we close the loop with the provider care teams with the use of the population health dashboard. And this is just a screenshot of that dashboard at an organizational level. And what it gives you is demographics of our patient population as it relates to their age and gender. Also a breakdown of how many people we might be following within the system that have chronic disease in the upper left-hand, or excuse me, upper right-hand corner. And then across the bottom, you'll see these radar graphs. And for those of you that aren't familiar with the radar graph, it's a relatively easy way to pack a lot of information onto one slide. So we'll take diabetes as our case example again. And I know the print is small, but you'll see this spider web radar graph. And the outside line basically means if your metric is touching that line, if the blue is touching that line, we're achieving 100% right now within our system on that particular metric. If you see gray, the gray is our benchmarking, and we benchmark against external organizations that we consider to offer excellence in patient care. So whether that be HEDIS or the Wisconsin Healthcare Quality Initiative or whoever we can benchmark against that we consider to be national leaders, we set our goal to be slightly above that with the idea that we want to deliver the best care possible to our patients. And so our goal is to see nothing but blue. And if you see some gray, that really highlights the opportunity for improvement in that area, and we can target initiatives to try to meet the needs of our organization and the patient population we serve. Next slide. We can also trend information. So the middle graph basically is looking at our tobacco initiative. How do we get the tobacco use status of our patients on the medical record in a retrievable manner? We launched an initiative back in 2008 to start recording that data and keep track of it, and you can see we were quite successful. Now up around 95% of all of the patients in our system we currently know the tobacco use status on. Next slide. The dashboards offer information at an organizational level, a departmental level, provider's practice level, but you can also drill down to patient level. So if there's a particular focus that one's practice has, say for instance, diabetes, we can pull up the patient list of all of the folks in my particular practice who have diabetes, and that's what I have displayed here. And we can sort any of those columns. So for instance, I could choose LDL control in my diabetes population as a need for my particular practice. I can sort this list, bring those that aren't currently at control to the top, and I can use that list then in an actionable way to try to reach out to my patients and improve their health between visits or in pre-planning for their next visit to try to make things go as efficiently as possible for that particular individual. Next slide. So really, this is a circular process. We have patients entering our system at any given time. At point of care, when they're there in the office, we're using the tools like the dashboard and pre-serve, medications manager, and others to try to make things efficient, improve the quality that we're delivering, and focus on patient safety. As we move up, we get to the point of the evidence-based guidelines. We base our clinical guidelines on ICSI, which is a group mainly focused in Minnesota, but also in Wisconsin as well. We're a member of that organization and actively participate in the guideline process. We try to embed those into the medical record as much as we can. We also recognize that the provider care teams require feedback, and that dashboard, the population health management dashboard, serves that purpose and is available and gives real-time information back to practices as to where their particular patient population currently stands. We recognize that there's needs outside of the organization as it relates to free-flowing information in both directions. We need information from others as to what's working so we can improve our process. We also want to share our learnings with others to promote the greater health of our nation. And then hopefully as you move around this circle in an iterative process, what ends up coming out on the other end is value, and that's our ultimate goal. Next slide. So I guess in summary, we feel the EMR is an integral part of our success in the PGP project, but I think far beyond that, we really recognize the value that it brings to our patients and the people of central and northern Wisconsin and how they are benefiting by the improved value of care they receive through the Marshfield Clinic system. And the EMR does not ensure value. It is a tool that we can use in the quest to improve value. Thank you.